Hi, this time I'm going to talk about lung cancer. The lung cancer is an overgrowth of malignant cells in the lungs. The cells degenerate and multiply uncontrollable, divide faster and destroy healthy tissue.
Treatment options for cancer include local therapies, such as surgery and radiation therapy, and systemic therapies, such as chemotherapy and targeted therapy. You may receive one or a combination of these treatments. There are several surgical options, depending on the type and stage of the cancer. During a wedge resection, or segmenectomy, the tumor and a small margin of healthy tissue are removed. In a lobectomy, or sleeve lobectomy, one lobe of a lung is removed. During a pneumonectomy, the surgeon removes the entire lung. In a sleeve resection, a diseased section of a large airway is removed, and the healthy ends are reattached. During any of these procedures, your surgeon may remove lymph to check them for signs of cancer. Radiation therapy, or radiotherapy, is a local treatment that uses high-energy rays to kill or shrink cancer cells to relieve symptoms. External beam radiation therapy is directed at the cancer's location from a machine outside your body.
Applications in medicine. How is lung cancer diagnosed? In addition to complete medical history for symptoms and risk factors and physical examination, you can do more things to diagnose this cancer. You can do chest X-ray to look for masses or a spot on the lungs, or a bronchoscopy to help to evaluate and diagnose lung problems, access blockage, obtain samples of tissues.
To make sure it's nice and clean, and then I just flushed it with some saline just to make sure there's some fluid in there and that everything's nice needle, which pierces the tube, and because there is a vacuum of the vocal cords, so you can make different pitches of sound, so you can go high and you can go low like that.
When you say E, just pull it very tight and say far. Okay. Now deep breath in. When you say E, just pull it very tight and say far. Okay. Now deep breath in.
Now, because the camera's going to go down into my trachea and into my lungs, the splashing you can see on the screen now is just anaesthetic that's been squirted through to numb that whole area. So once everything's numbed, the camera was put through the vocal cords down into the trachea, and you can see the cartilage rings over the top. And
It's important to know what are the benefits and adverse events to smoke cigarettes. If you don't smoke cigarettes, you will have a healthy life, and your lungs will be healthy and your oxygen will be pure. And the adverse events are bad breath, lungs damage, and die.
Up to 25% of Americans smoke, and 400,000 of them die from the consequences of lighting up every year.
Smoking is a major health hazard and has been dubbed the chief preventable cause of death in our society by the Surgeon General. In fact, smoking currently causes 1 out of 5 deaths in America. What do an actress, a late-night talk show host, a baseball player, a singer, and the founder of a multi-billion-dollar corporation have in common? Each of these public figures was a heavy smoker, and each ended up dying because of their tobacco habit. If you're a smoker, the effects of tobacco spread to literally every part of your body. Let's take a closer look. A mere 3 seconds after the first puff of a cigarette, the 4,000 chemicals in the smoke make your eyes water and nose run. They also irritate the throat, causing the infamous smoker's cough. And continued exposure to smoking thickens the throat's membranes, resulting in cellular changes that can lead to throat cancer. Smoking's biggest impact, though...
Diseases. There are many types of lung cancer, but I'm going to talk about two types. Lung cancer known as small cell. It has three forms. Squamous cell carcinoma. It usually starts in the bronchi and usually doesn't spread as fast. Another form is adenocarcinoma. Usually begins along the outer edges of the lungs and under the lining of the bronchi. Another type, large cell carcinomas. These tumors usually begin along the outer edges of the lungs.
When people are diagnosed with lung cancer, most of them are unaware that lung cancer has many different types. Each of these different types of lung cancer are treated and looked at differently by medical professionals. It is important to know all about the type of lung cancer that you may have so that you can get a better understanding of it if you are affected. If you are someone who has a certain type of lung cancer and would like to learn more about it, this information may be beneficial to you. Lung cancer, according to Medical News Today, is defined as the uncontrolled growth of abnormal cells that start off in one or both of the lungs. These cells divide rapidly and form tumors. As the tumors become larger, they prevent oxygen from getting into the bloodstream. It is mainly caused by smoking, and it is a common deadly disease with as many as 1,370,000 people that die each year from lung cancer. As the cancer forms tumors, the tumors can be classified as either benign or malignant. Benign tumors are tumors that remain in one place and do not appear to spread. Malignant tumors are the more dangerous ones. These spread to other parts of the body, either through the bloodstream or the lymphatic system. Lung cancer is also put into two categories, primary lung cancer and secondary lung cancer. Primary lung cancer originates in the lungs, while secondary lung cancer starts somewhere else in the body and eventually travels into the lungs. Another piece of information that people do not know about lung cancer is that there are two different types of it. Many people think that lung cancer is just a single disease, but in reality, lung cancer can develop in different types depending on how the cancer forms. The two different types of lung cancer are small cell lung cancer and non-small cell lung cancer. Small cell lung cancer makes up only 20% of lung cancers. This type of lung cancer is the most aggressive and rapidly growing of the lung cancers. This type of lung cancer mostly occurs in smokers. Only 1% of this type of cancer is found in non-smokers. This type of lung cancer is usually discovered after it has already been extensively spread. Non-small cell lung cancer is the most common type of lung cancers, which make up 80% of all cases. Non-small cell lung cancer is categorized into three main types based on the type of cells that are found in the tumor. The first type is called adenocarcinoma, and it is the most common type of non-small cell lung cancer. This can be associated with smoking, however, many non-smokers, especially women, have been known to develop this type. Most of this type of lung cancer develops in the outer areas of the lungs and has a tendency to spread to the lymph nodes and beyond.
Lung cancer is lung cancer small cells that have two forms, limit and large. Limit, the cancer is only in one lung. Cancer can also occur in the nearby lymph nodes on the same side of the thorax. And another type, large, the cancer has spread beyond the primary tumor in the lung in other parts of the body. Well, that's all. I hope you like it, and this video is a summary where this doctor speak about this topic and say many things about this.
ET, chief of the section of thoracic surgery at Columbia Presbyterian Hospital. cancer that actually begins in the lung. It grows out of the lung cells that, if left alone, can really hurt the patient. Lung cancer predominantly has been caused by smoking in the past. Lung cancer symptoms can be varied. Many times, initially, it's asymptomatic. In other words, the lung cancer is growing there and not causing any symptoms, and we have to pick it up by screening tests and other parameters. However, cough, coughing up blood, weight loss are probably the biggest symptoms. And sometimes people can present with pain in their shoulder or pain in their arm as a very early symptom of a lung cancer.
Hello everybody, my name is Jose Moreira. I'm going to talk about the tricuspid valve, which is an interesting topic, and I'm going to say you all the definition, the application in medicine, the pros and cons, and diseases. Let's go. Definition. Well, this valve is called tricuspid because it consists of three membranes that receive tissue from the wall of the right ventricle of the heart, and is located between the right atrial and the right ventricle.
The AV valves, or atrioventricular valves, have an atrium above them and a ventricle beneath them. This valve is the right AV valve because this is the right atrium and this is the right ventricle. So this then is the right AV valve. It has chordae tendineae attaching to the cusps and anchoring them into papillary muscles. The right AV valve has three cusps and is also known as the tricuspid.
Applications in medicine. The tricuspid valve is important because controls the passage of the blood from the right ventricle to the right atrium and prevents the return of the blood. If the blood don't return to the right atrium, we will have a problem in the contraction in the right atrial and the right ventricle. That's why the tricuspid valve have to open and close when our heart needs that.
A pump which must circulate blood through two different but interconnected vascular systems. The smaller of these systems is the pulmonary system. Blood returning from the upper part of the body is delivered to the right atrium of the heart by the superior vena cava, one of the body's two largest veins, while blood returning from the lower part of the body is delivered to the right atrium by the other major vein, the inferior vena cava.
Pros and cons of replacing the tricuspid valve technology by transcatheter. I put the benefits and the adverse events to make that. And the benefits are we will have a general or local anesthesia, the heart pumps normally, and the patient breathes independently. And the adverse events are heart attack, stroke, and death. The tricuspid valve has many diseases, but I put the most important for me, and I put tricuspid regurgitation and tricuspid stenosis. The tricuspid regurgitation is a backflow of blood from the lower right chamber and to the upper right chamber. That occurs for a tricuspid valve damage or an enlarged right ventricle. The blood returns to the veins and don't go to the lungs where it can pick up oxygen.
I'm Dr. Justin Davis, and today I would like to tell you about a condition called tricuspid regurgitation. Now, exactly what is tricuspid regurgitation? Well, first, before you can understand that, you have to understand a little bit more about the heart. The heart is divided into 4 sections, a left and a right, and an upper and a lower. Each of these sections is divided from another one by something called a valve. A valve, just like in plumbing, allows things to flow, or in our case, allows blood to flow in one direction, but prevents it from flowing backwards. And this is very essential so that the body can have a proper circulatory system and it doesn't flow backwards. Now, the tricuspid valve.
So this right is information that I said before to what is the cause of the tricuspid regurgitation. We will continue to what is the tricuspid stenosis. The tricuspid stenosis, it's just a blockage that prevents blood flow. It's a little definition about that. Finally, the tricuspid stenosis is usually associated with rheumatic fever and is not hereditary.
Okay, let's talk about tricuspid and pulmonary stenosis and regurgitation. We'll start off with tricuspid stenosis. And tricuspid stenosis, it's more common in females than male. And it can also happen from rheumatic heart disease. And you know, rheumatic heart disease is primarily in the mitral valve, but there's small percentage of chance that it can happen in the tricuspid, and that can also happen in the pulmonary valve. But whenever you think of rheumatic heart disease, you think of the mitral valve. And so what happened is that the stenosis, that the valve is just stenotic. It's stiff, it's hard, it doesn't open and close as properly as it should. You see here, you see blood just flowing through very easily. Here the valve is stiff and it's stenotic, so the blood has to go through a narrow passageway. So what happens is that, as you see here, there's very little blood coming through here, so that increases the pressure in the right atrium, and so there's right atrial hypertrophy, and also the right atrium becomes dilated, and it will contract stronger. And so since there's no valve between the right atrium and the superior vena cava, then since there's so much blood and pressure here, the blood is going to backflow up the inferior vena cava, and then you're going to have prominent
tricuspid valve repair. The instruments and sutures needed for this procedure are described in the workbook. The heart is prepared and mounted as shown. The right atrium is opened to expose the tricuspid valve.